So in 2020, when I first started hearing about COVID, this was in January, and there were reports that were trickling out of Wuhan, China. I didn't like what I was hearing because I had been doing a lot of writing in the past about emergent diseases, about viruses, about parasites, about all the rest of it all. Um, I've written a book, A Planet of Viruses. I've written a number of articles for the New York Times and elsewhere. And, and so I would talk with, colleagues who've also written a lot about emerging diseases. And we'd say, it's a coronavirus. That's not good because we knew that coronaviruses had already spilled over from animals twice in the previous 20 years for SARS and MERS. And in both cases, it was extremely deadly. So, it wasn't a good feeling. And then it took a little while to sort of get to understand, like, okay, this is something that it has a lower mortality rate than SARS or MERS, but it was spreading. Clearly, it could spread easily because, the entire city of Wuhan shut down just in the vain hope of stopping this thing. It didn't. So by February, I was telling my friends, like, there's this, have you been hearing about this thing in China? You need to be getting ready. You need to get ready for, severe disruption.
Yeah, interesting. And I mean, for those who haven't read the book Airborne, there are several parts to it, but a predominant chunk of the book is historical. Is the journey of how we got here to modern science, really. But there's also a good third of the book, I'd say, dedicated to the more recent history, certainly since kind of the Gulf War and onwards, and some of the politics that came into play around the pandemic. Was that kind of where your head started in that part? Was that what you thought you were going to be writing about, and the history kind of came to the fore? Or, as you said earlier, people were already pointing you at the very beginning and going, look, there's a long story here that goes way back. And so did you find yourself just tracking back and back and back, trying to answer that, how did we end up where we are type question?
Yeah. I mean, whenever you're writing about history, I mean, this is a challenge, how far do you go to try to answer your questions about why things are the way they are today? And certainly, from the outset, like, I knew that I had to do some historical research because, I was being pointed to William and Mildred Wells, who were this American husband and wife team who figured out a lot of the basics of airborne infection in the 1930s and 40s. They worked it out, and then were forgotten. And so I knew that the book was going to have to draw connections at least to them. And so I did a lot of archival research to understand who they were, because there's no biographies of them. There's very little about them in terms of biography. And along the way, I just started discovering lots of other people. And really fascinating people, and people in incredible conflicts, and, battling over the nature of the air, the nature of disease, all of these profound questions. And after a while, you sort of realize, like, oh, well, really, you even if you limit yourself just to sort of Western thought, you should probably go back 2,500 years because for so long, we were dominated by this idea of miasmas, that the air itself could be corrupted, and that would cause diseases like malaria, like plague, like influenza. And, how did miasmas hold sway for so long? And then how did they suddenly collapse? And then how did that connect to our sort of rediscovery of airborne infection today? So there's just all sorts of fascinating connections the more you look.